All right, thank you, Audra. A new study from the journal Cancer found colon cancer rates are dropping for people 50 and older, but people under the age of 50 are seeing an increase. I sat down with an expert to talk about why we might be seeing this rise and what we can do about it.
You know, we know that factors that impact colorectal cancer are a poor diet, lack of fiber, lack of physical activity, obesity, smoking, and drinking alcohol excessively, which the recommendation of the Cancer Society is not to drink more than 2 drinks a day for a man and 1 for a woman.
Gotcha.
Just based on statistics. So we know that may be something if we think the younger population has becoming less active, has poor her diet, but as we were talking earlier, that doesn't fit with you hear about the triathletes who end up with.
Exactly. We just saw that the other day, a father in his 30s who passed away.
And we've got people on our task force here in that situation, and I think that just tells us that we don't know. Okay, and there's lots of theories, and somebody can present one and they talk about it and they say, yeah, what about this and what about that? So that's something we need to try to learn. It's colon cancer, we know, is multifactorial. It's affected by all of those issues I just mentioned, but there's genetics involved, which can have a huge impact.
When should you start getting screened for this?
Well, the newest recommendations say start at age 45. If you're just a normal risk person, that means someone who has no family history and they have no symptoms and no personal history, for instance, of polyps or a cancer.
And Jerry, we have a fundraiser coming up. Tell us a little bit on what you have going on.
Well, yeah, Courtney, every year we here in Douglas County, the Great Plains Colon Cancer Task Force is doing our best to raise the awareness of the importance of early screening and detection for colon cancer. So we're in our 11th year of a race we call the Boxer 500. And it's a short race, or we can call it a brief race, to raise
I love that.
to raise awareness and to lighten up the whole conversation about colon cancer and screening, because unlike breast cancer and some of the other cancers that are so more easily talked about, this is one of those subjects that it gets a little taboo, I think, at times. So it's a celebration for survivors and their families to come out and celebrate early screening, and a survivor rate is going up here in Douglas County, as well as to honor family members who maybe did not survive their diagnosis. So it's a lot of fun. It's at Warner Park. Great family event. We have the Pancake Man. It's a 5K walk or run. Very family-friendly course for whether you walk it or run it, and it's just a great event.
What do you think is one of the misconceptions or most common misconception for people about colon cancer?
So I think that a very common misconception is, I feel fine. I don't have a problem. And that's exactly the person that needs to be screened. With colon cancer, if you wait until you have some symptoms, not always, but frequently that means it's already starting to get advanced. So you don't want to wait until you have a symptom such as bleeding or abdominal cramping or change in bowel habits. Those are all things that you don't want to sit around and wait to get screened for that.
The Boxer 500 Run and Walk is at Warner Park on the 11th. For more information, go to coloncancertaskforce.org.